Jeff, who's a very well-known dentist in Stratton, Connecticut. And thank you for joining us on this interview. I would appreciate it if you would give a little bit of your background so that the listeners can know who you are, and then we could start discussing the PeriActive product.
So I couldn't be more thrilled to spend time with you. I have been a dentist for 42 years. I cannot believe it when I say that. I graduated from Tufts Dental School in Boston in 1978. I worked as an associate with someone. I was only fired from 3 jobs. That was all, only fired from 3 jobs. And then my wife said to me, we're going to open a clinical practice. I started with a 1-chair office on a 2nd floor of a building without an elevator. And I grew my practice $100,000 a year, every single year. And now I have a staff of 25. There are 4 of us in the practice. We're open 6 days a week, 4 evenings a week. And we have 7 hygienists on staff.
And
I guess I could tell you that I was just on the cover of Dentistry Today. I was on the cover of Dental Shopper. I'm a co-editor of a number of different magazines. I've written numerous articles. I teach implant dentistry. I teach cosmetic dentistry. Before you know it, I'm going to be really old.
and experienced. So, Jeff, we introduced you to PeriActive, I think it might be around 5-6 years ago at this stage. Tell me about your initial reactions to the product, how you're using it, and how you feel it fits into your practice, and some of your patient reactions as well.
So I have an interesting background when it comes to medicaments and use in the dental practice, because at one time I was involved with the company that we marketed a product for subgingival irrigation. And I have been on, I'm going to call it the cutting edge of treating periodontal disease with conservative methods. What's interesting to me is one of the first lectures that I gave many years ago, a gentleman that many of you have heard of named Paul Kais was in the lecture. And Paul Kais came up to me and he said, "You, sir, are running in a different orbit." And I really didn't understand what he meant. And then he said to me, "Because you understand treatment of periodontal disease is not only managing disease, but it's managing the patient and having patient compliance." And I think that's really the key. We all understand what causes periodontal disease, but we have to understand there's a patient management component. So for many years, I was using different modalities from treatment, from CHX to other products, including warm salt water. And I will tell the story that I was walking along in a dental conference, and I met you. And I remember the sign quite clearly that we want to do conservative management of periodontal disease. And when I started speaking with you, you said to me, "You seem to know a lot about this, or you seem to have experience in this." And I said, "Well, and I gave you a little bit of my background." I said, "You know what? I'm going to try this." I decided that when I got PeriActive for the first time, I would try it myself, interestingly enough. I would try it myself. And I do sort of some crazy things, like I'll brush half my mouth with something, brush the other half of my mouth with something, and then I'll do plaque scores. I mean, it's a little nuts. But what was fascinating was I had a patient that came in with a mucositis as related to cancer treatment. And I said to the young gal, "I want you to try this mouth rinse to see if it's comfortable for you or see if it does something." Really not expecting too much, because the oral surgeons and the cancer guys had her on CHX and her teeth were staining and didn't taste good to her, or she was difficulty with it. About 2 weeks later, I got a call from the oral surgeon at Yale saying to me, "What did you give my patient?" And I was thinking, of course, the worst. When you get these phone calls, when you think the worst immediately because we're dentists. He said, "The results that I'm seeing are remarkable. The patient is comfortable. She has no more tissue sloughing. But most importantly, a lot of the lesions in her mouth are healing." That caused me to think, wow, maybe this is really something. And so I had been using a previous product with my patients. And what I will tell you is all of my patients in my practice, almost all of them, are using PeriActive. And the reason is that the clinical results I'm getting in terms of gingival inflammation, healing of lesions, patient comfort, has been remarkable.
Are there any specific incidences that you could recall, aside from what you described earlier, but something more aligned with the conservative dental care, that you remember PeriActive having a big impact?
Sure. My practice has a crazy name. It's called Brush and Floss Dental Center. Crazy name. And the reason it's a crazy name is when I started my practice 42 years ago, I used to write on the backs of people's checks, "Don't forget to brush and floss. Don't forget to brush and floss." And then people started answering the phone.